All right, hello everybody. Welcome to your infectious diseases lecture. I apologize for the delay. I've experienced some technological difficulties, which I'm sure many of you can relate to. There is no reading on this for this week, so just please pay attention for these next couple slides because it'll be crucial information that you will need on your exam for this week. All right, so let's talk about what infectious diseases are specifically and what they're made of. So these diseases are basically disorders caused by some sort of organism, and that can range from a bacteria, a virus, a fungi, or a parasite. As humans, we are made up of many types of organisms, but some of them can be more dangerous than others and cause more harm than good, which can cause these certain types of diseases. These microorganisms that we're talking about are called pathogens, and you're probably hearing those words a lot with the state of the world that we're in right now with the current coronavirus COVID-19 pandemic. Infectious diseases are the leading cause of death worldwide, and they can become extremely hard to control if they become resistant to certain common drugs, like antibiotics. They can mutate, they can acquire new genes that can allow them to survive alongside these types of drugs, which can become very dangerous and fatal to the human population. So let's first talk about viruses. Viruses are infectious agents that replicate within that living cell only. So that's what we're dealing with right now with COVID. And they can affect everything from a person to an animal to a plant to an amoeba as well. So these are incredibly dangerous. And there's no really treatment for these. We have some antiviral treatments and stuff like that, but antibiotics don't work for viruses. Next, we're going to talk about bacteria, and these are single-celled microorganisms, okay? If you've taken any sort of science class, you'll probably hear single-celled a lot. Um, some bacteria is actually super beneficial for our immune systems and just daily life, and less than 1% can actually make us very ill. So bacteria grows and divides and spreads throughout the body, and the toxins they give off can make them more severe. These can be treated with antibiotics mostly. Um, yeah, so fungi next. These are microorganisms, and these are usually harmless, and usually we can eat them. We have a lot of fungus living in it on our bodies. They reproduce by releasing spores. But these can be dangerous because they can affect our lungs, our skin, and our nails. And then they can penetrate within the body and create whole body infections. Examples of this is ringworm, athlete's foot, etc. The next is kind of the grossest thing is parasites. These are those gross little things that live in or on another organism and get their nutrients from their host. So these live in our blood, liver, digestive system, in our brain, in our eyes. You hear those horror stories about people living with parasites for many, many years, their whole lives. Examples are roundworms and tapeworms. So that's a conjecture of what infectious diseases are. Next, we're going to learn about how they spread. All right, let's talk about how these diseases are spread. So most commonly is that person-to-person contact, whether that's touching, kissing, coughing, sneezing, or any bodily fluids from sexual intercourse. Exposed blood is a main contraction route, whether that's topically through your skin, a needle prick, a tattooing, anything like that. Next is zoonotic diseases, and these are transferred from animal to person. Think the rabies virus, that's from being bitten or scratched. Also, animal waste that is consumed, whether indirectly through food making in that same vicinity. You can get an infectious disease from an insect, a mosquito most commonly, fleas, Lyme disease, I mean, ticks, sorry, Lyme disease, or lice. We're going to be talking about dengue and all of those fun things. Another main source is contaminated food or water. It's whether your food or water has been exposed to the environment that the organism is living in. Undercooked food is a huge thing. Think salmonella, etc., E. coli on your food. Um, Indirect contact on inanimate objects. So viruses and bacteria can linger on these inanimate objects by indirect contact. And so we've learned um, so much in the past couple of months about COVID and how much we touch our face. You can touch your face up to 10,000 times a day. And so we can contract these diseases if we touch an inanimate object through our eyes and nose and mouth. All right, so first on our list of infectious diseases is hepatitis A, B, and C. You've probably most commonly heard about hepatitis C. It's quite a huge issue in Bali currently. They're acronymed HAV, HBV, and HCV. They are caused by the hepatitis virus. We're going to talk briefly about each. So hepatitis A, or HAV, is transmitted through fecal oral route, and I don't mean someone is eating human feces. It's spread by close contact, so it's transmitted from person to person contact, normally sexual contact with an infected person, or ingestion of contaminated food or water. So that someone had just gone to the restroom and then goes and prepares your food and they are an infected person and is easily to get cross-contaminated that way. The HAV virus does usually not develop into serious complications or any sort of chronic infection like its sister viruses, more say hepatitis C. So hepatitis B is going to be, or HBV, is spread through infectious blood, semen, and other bodily fluids, but it's most highly found in blood. And I'm going to be talking about this thing called percutaneous exposure. Basically, um, exposure into the skin by the through blood. So any needle stick, any sharp injuries that exposes your blood, as well as splashes leading to exposure of the skin or mucosa to the blood. Contaminated needles, syringes, drug equipment, etc. HPV is a huge route for that. And chronic infection with HPV is really, really low. It's about 5% of adults, so most people can recover from this virus. However, when we talk about hepatitis C or HCV, this is also found in the blood. So it's spread through percutaneous exposure to infectious blood, mainly sharing needles, syringes, any other drug equipment. It's usually less contracted through sexual intercourse, um, unregulated tattooing, etc. But however, then the chronic infection rate for this is over 50% of infected people can suffer from chronic infection. The main thing we're worried about here is liver inflammation and damage. Hepatitis C can be quite an interesting virus. Half of the people that have contracted HCV don't really know that they are infected. The chronic symptoms can take decades to appear sometimes. So this is something you always want to be screened for, especially if you're exposing yourself to these types of environments. Long-term infection is silent, and then it eventually damages the liver, like I said, due to scarring, cancer, and then liver failure. Like I said, hepatitis A and hepatitis B, most of the patients or all of the patients can usually recover from this virus. However, hepatitis C is a bit more tricky, and over 50% of infected people suffer from chronic um, infection. However, all three of these represent with the same acute infection symptoms. So when someone gets exposed and infected, they will probably present with these sort of symptoms for all three. And like I said, with hepatitis C, those longer dormant symptoms, chronic symptoms can remain dormant for a long period of time. So with someone with acute infection of HAV, HBV, or HCV, we're talking about jaundice, which is that yellowing of the skin, a fever, fatigue, nausea, vomiting, abdominal pain, joint pain, dark urine, and diarrhea are all symptoms we want to look out for and monitor for. So for treatment for these, there are some treatments on the market right now that can help people with chronic infections and getting over those and helping maintain a healthy lifestyle. However, the only true way to get know if you have one of these is obviously the doctor will diagnose your symptoms and then blood tests as well. But the main thing we want to know here is prevention. We want to always protect ourselves when we're exposed to dangerous environments, especially if there is needles, syringes, any unregulated tattooing, and especially when we deal with our sexual contact with other people. Always educate yourselves before engaging in any of these activities. Next, we're going to talk about HIV and AIDS. These can be commonly assumed as the same thing, however, they are not. HIV is going to be the virus that leads to AIDS if left untreated. So, HIV is the human immunodeficiency virus, which attacks our cells that help the body fight infection. This then leaves our body more vulnerable to other infections and diseases. It is spread by certain bodily fluids, so through unprotected sex or through sharing injection drug equipment. Like I was saying, that percutaneous exposure. So having vaginal, anal, or oral sex with an infected partner whose blood, semen, or vaginal secretions then enter your body through mouth sores or small tears in your rectum or vagina are ways that we can contract HIV. HIV, like I said, if left untreated, can lead to AIDS, which is the acquired immunodeficiency syndrome. There is no effective cure for HIV. Our bodies simply cannot get rid of it, and we unfortunately have it for life. However, nowadays there is some amazing modern medicine that can help maintain people who have contracted HIV with a very healthy life. And they can take this every day. It can prevent it from passing it on to their partners, the virus, etc. It's pretty amazing. However, it is not a cure. So AIDS is going to be a late stage. So it's basically when the body's immune system is so badly damaged because of the virus, we acquire AIDS. Um, like I said, people can take HIV medicine every day, which can help stop the progression of the disease, but it does not cure it. Without HIV medicine, however, the life expectancy with someone who has contracted this is only 3 years. HIV is most commonly spread during its primary infection. So when we think about this, someone with an HIV infection is going to present with these acute symptoms of a high fever, headache, weight loss, sore throat, rash, a productive cough. Um, yeah, so those are the signs and symptoms we want to look out for, especially if someone has just recently been exposed to any of these certain environments where they have may contracted it. Like I said, you have this virus for life. So people with chronic HIV, during that stage, they may sometimes not have symptoms or even infections during this time. However, when they do become symptomatic, um, they may suffer with fever, fatigue, shingles, pneumonia. Um, Without treatment, it progresses to AIDS in about 8 to 10 years. Nowadays, people can live really healthy, long lives if they have HIV with certain modern medicine. However, most parts of the world aren't as lucky as some, and there are sweeping epidemics of HIV, which can be very, very deadly and detrimental to populations in third world countries. With any suspicion of HIV, we can get our blood tested, and we're looking for those acute symptoms as well, and any history of exposure to any of these different routes that you can contract HIV. The main thing here is prevention and education, avoiding those risky behaviors and risky environments, and protecting yourself against other people and educating yourself and others. All right, next is we're going to be talking about is typhoid fever, and this is going to be one of those tropical diseases you may have heard quite a lot about, living in Bali. Typhoid, there's two different types. So there's typhoid and paratyphoid, and this is a life-threatening illness caused by a bacteria. It infects about 11 to 21 million people worldwide, specifically in those tropical and subtropical hot zones. It's common in parts of the world where our water and food may be unsafe and the sanitation is quite poor. So Southeast Asia, especially, and it's quite rare in Western countries. So typhoid is spread through sewage contamination of food or water, and then through person-to-person contact. So So what I mean by that is if we eat or drink any food that has been touched by a person currently shedding the virus through their feces who has not washed their hands, people who are currently ill as well, and those that have recovered from the virus, but the virus still remains in their stool. So it can be kind of sneaky. It can be in our water from the sewage. And any food rinsed in water that we eat, so especially raw foods we want to be mindful of. This bacteria gets into our bloodstream and starts to multiply. Typhoid fever is linked to a salmonella species called Salmonella typhi. Uh, the salmonella is transmitted by, like I said, contaminated food or water, and the people can transmit the disease without even knowing that they have it. Like I said, through cooking in a restaurant, even if they may not have any symptoms. There are vaccinations for typhoid, however, not for paratyphoid. So before you travel anywhere, well, I mean, most of you live in one of these countries, you can get your vaccination that can help prevent you from contracting typhoid. You always want to watch what you're eating and drinking, and this is not spread by animals. So those symptoms of typhoid is going to be a high fever, weakness, headache, stomach pain, diarrhea, cough, loss of appetite, and a rash of these like little rose-colored spots all over the body. Is going to be tested through a sample of blood or stool, and they're going to test for Salmonella typhi or Salmonella paratyphi. So if you suspect someone that you know or you um, may have typhoid, you're going to want to go to the local hospital or doctor and have your blood or stool tested. And you're going to want to have them test for these specific types of bacteria, Salmonella typhi and Salmonella paratyphi. If it is positive, you will probably get a round of antibiotics that you will want to take fully, um, because without treatment, people can have a severe fever for weeks or even months. Um, Even if your symptoms don't go away, you may still have the bacteria and it can return and you can pass it to other people. So, by staying course with your antibiotics, if you do have typhoid, making sure you're taking your antibiotics, washing your hands with soap and water after using the restroom, and making sure you're not preparing or serving food to other people um, during the time of infection, during the time of antibiotics, and for a good time afterwards. You really want to protect other people in your household or your friends, because without treatment, it can be quite deadly. Next is dengue fever. And dengue fever is going to be a virus. And this is going to be one of those viruses spread by an infected mosquito. It's common in more than 100 countries worldwide, and about 400 million people each year get infected. Like I said, it lives in those tropical, subtropical zones of the world. And what most people may not know about dengue is there's four different types of viruses: dengue 1, 2, 3, and 4. So if you get dengue, you're not immune to it. You can be infected up to 4 times in a lifetime, which can be quite deadly. The best way of prevention is going to be using proper clothing, um, just preventing yourself from getting those mosquito bites, using repellent, nets, knowing which countries you're most susceptible to, if there have been recent dengue outbreaks. Um, and you want to protect others. So dengue is found in the blood in the first week of infection. So if you have any suspicion, make extra precautions to protect yourself, because um, this virus can be transmitted back to mosquitoes and then, i.e., to other people. So for symptoms, about 1 in 4 people actually get sick, and these symptoms can vary from mild to severe. They can definitely be life-threatening within a few hours and requires hospitalization. So we want to look out for um, eye pain, fever, a headache, rash, severe bone, muscle, joint pain, so like body aches, and any nausea, vomiting. There's no treatment for dengue. However, we're going to be treating these symptoms. So they usually last between 2 to 7 days. So rest is key. Fluids, hydration. You can take acetaminophen or any fever reducers, but we don't want to take aspirin or ibuprofen. And fluids. When we're talking about severe dengue, um, this is where we want to go to the hospital immediately. And a blood test is really the only way to know if we have dengue. So if it's something that you suspect, transport immediately. So we're looking for those signs and symptoms of shock, which can lead to internal bleeding and even death. They can develop severe if you had it before. So if you've had dengue 1 and you contract dengue 2 or 3 or 4, you're more likely to develop a severe case of dengue. So we want to look out for these vomiting 3 times in 24 hours, any blood or nose from the nose or the gums, and especially any blood in the stool or vomit, are all signs and symptoms of severe dengue. So, in all, looking back, dengue infects a lot of people worldwide. It's transmitted by mosquitoes, so the best way is to protect ourselves and others from getting it in the first place. If we do get it, we're going to treat the symptoms within 2 to 7 days. We're going to look for those, the eye pain, headache, rash, fever, um, etc. If we suspect that we have it, we want to protect others. So we want to be even more mindful about protecting ourselves from getting mosquito bites because our infected blood can get back into mosquitoes, which can then infect another person. We really want to note those signs and symptoms of a severe case of dengue. So any blood or nose from the stool, vomit, nose, etc., and transport immediately. And the only way to know if we have dengue is going to be a blood test. All right, finally, we're going to be talking about sexually transmitted infections, otherwise known as STDs or venereal diseases. These are passed from person to person through sexual contact. This can mean any unprotected sex, vaginally, orally, or anally, any genital touching as well without having sex, such as syphilis or herpes, you can contract. Some of these infections can be cured, and some cannot. They most uncommonly can be spread through needles and breastfeeding. However, I want to talk about the difference between STIs and STDs. So STD stands for sexually transmitted disease. Most of you know that. It's the most commonly used term for these types of infections that we talk about that are transmitted through sexual contact. However, most people nowadays, especially in the medical community, are transitioning over to talking about these as sexually transmitted infections. So, what I mean by that is that people who become infected don't always sometimes experience any symptoms or that their infection develops into a disease. So, that's why they've introduced this more modern term called STIs or sexually transmitted infections. It's basically an effort to clarify that not all STIs or infections turn into a disease. So if someone or woman has contracted HPV, the human papilloma virus, um, it can develop into the resulting disease of cervical cancer. But in fact, most cases of someone with HPV will clear up in 2 years. So it just kind of takes away the stigma as someone of having an STD. Meaning that these infections that the viruses causes, most people can get over and it doesn't develop into a disease. So we're going to talk about just a few. I'm not sure what the sex ed class is in green school, but I'm just going to go over a few things that you want to look out for in each of these infections, what they are, how they present, how you can treat them, and the best way to prevent yourself from getting one. So chlamydia is probably the most common STI. It's caused by a bacteria. And it may present itself with no noticeable symptoms. And this is the tricky thing, especially with engaging in any sexual activity. You may not know that your partner has chlamydia or that you have chlamydia and you're passing it on to someone else. If you do have symptoms, they present as pain or discomfort during sex or urination, a green or yellow discharge from the genitals, pain in the lower abdomen. However, this bacteria, if left untreated, can lead to bladder infections, prostate or testicle infections. Chlamydia is treated with antibiotics. So if you are experiencing any of the symptoms, definitely go get tested. However, I want to instill the practice of always getting tested. So no matter if you're engaging with a new sexual partner or a current or old sexual partner, it's highly recommended getting tested definitely yearly, even 1 to 2 times a year, depending on what environments you expose yourself to. But that's the best way to protect yourself from knowing if you have one of these, especially if you don't have any symptoms, and protecting other people as well. HPV is going to be the human papilloma virus. And this virus is transmitted through intimate skin contact, or through or through any sexual contact. There's many different strains, and some can be more dangerous than others. And like I said, when we talk about STIs, someone with HPV doesn't necessarily have a disease unless it progresses to something worse. So it presents itself most commonly in a form of warts on the genitals, mouth, or throat. And some of these strains, like I said, can lead to cancer. There is no treatment for HPV. However, there is a vaccine for some of the more dangerous strains, and that's something you can take on yourself, especially as a woman, to determine if you want to get vaccinated against this. Um, it's just another way to help protect yourself and others. All right. Next is syphilis. And syphilis is another bacterial infection. And this can kind of be one of the most dangerous STIs. When we talk about syphilis, sorry, the first symptom that we can see is a small round sore on our genitals, our anus, or our mouth. It's usually painless, but it is incredibly highly infectious. So you want to look out for that, especially if you've been exposed to all sorts of environments. And the later symptoms that you will see present will include a rash, fever, fatigue, headaches, joint pain, hair loss. So if you're noticing that signs and symptoms of that first round sore and then it progresses and you start feeling some of these things, you're going to want to get tested immediately. Syphilis is a really wild bacteria. If left untreated, you can get loss of vision, hearing, memory, mental illness, brain. It can spread into your brain and spinal cord, and even death. So, like I said, protecting yourself and getting tested yearly, or if you're experiencing any of the symptoms, is your best route. And then syphilis is treated with antibiotics, so it can definitely recover from syphilis. But if untreated, it can arise some serious complications. Next is going to be another bacterial infection called gonorrhea, or the clap, if you've heard that before. Some symptoms of this is you're going to notice that white, yellow, green discharge, pain or discomfort during sex or urination, a more frequent urination, a lot of itching around your genitals, sore throat. And like syphilis, if it's left untreated, it can lead to a lot of other infections and infertility. Which can be a serious complication. So it's also treated with antibiotics. It's a bacterial infection. So if you're presenting with any of these symptoms, definitely go get tested and get on those antibiotics as soon as you can. You don't want to leave any of these untreated, especially, I know they can be embarrassing and stuff like that, but you're going to want to reach out and educate yourself and others, hopefully protect yourself the best. Next is herpes. This is a virus, and there's two main strains of these, and both of them are transmitted sexually. There is HSV1, which is oral herpes, or basically cold sores. And the way this progresses to HSV2 is when one person's mouth to another person's genitals during oral sex or during oral sex, or which presents with genital herpes. However, there's no cure. It's a virus for this, but we're going to control those symptoms with medications. If there is an outbreak of, cold sores, oral herpes, or genital herpes, there are medications to control those outbreaks and alleviate the pain of sores. If you do contract herpes, the best way to protect yourself and others is knowing when those outbreaks are happening and not engaging in any sexual or intimate activities, and especially if it's with a new partner or an old partner, and always educating yourself on the best route. So, like I said, some of these do have cures, some of these don't. You can get over them or you can have them for life, and they can develop into severe complications. Prevention, getting tested yearly or bi-yearly is I highly recommend, even if you have no symptoms, whatever. It's just in practice of good health. And then knowing where you can get a good trustworthy set of antibiotics and what you're looking for. So yeah, that's my STI, STD talk. If you have any questions, don't be afraid to reach out to me. with any of these infectious diseases. It's a widespread, and there are definitely many, many more out there in the world. I just touched on a few of the common ones. We're going through the COVID-19 outbreak right now, so hopefully this touches on some of those notes as well. Like I said, we don't have any readings on this, but if you are curious about these, sometimes they can instill a lot of fear, but I think education is the best way to conquer that fear. So, or asking questions, anything like that. Yeah. So with that, I conclude my lecture, and yeah, good luck on the exam.